everyone expects to feel tired during treatment. But then after chemotherapy treatment and radiation treatment, when the cancer is cured, people expect that the fatigue will go away too. However, oftentimes it doesn't, and people don't know why. There has been a lot of research in the last 10 to 15 years about circadian rhythms and how important it is for your exercise and your eating and your daytime activities to be done during the daytime hours and not at night. So we are building off that literature on circadian rhythms and applying it to cancer symptom science. And we're asking people, if you just take your meals, if you eat them within the daytime hours, does it help sleep better at night and have more energy during the day? We're finding that people who do engage in time-restricted eating or eating all of the meals within the daytime hours, it really does help people have more daytime energy. When people come into our labs for assessments, we do several different activities looking at physiology. And we look at how the body can adapt from regular changes that go on every day. So from when people are fasted to when they're eating. We look at blood glucose. How does the body respond to eating something? We look at blood pressure, laying down to standing up. How does the body respond to that? When the body can adapt to regular changes, regular everyday changes, it also can better tolerate cancer treatment. It can also better predict when it's going to get energy, when it's going to use energy, and we predict that that'll help people have more energy during the day, sleep better at night, and just be healthier overall. All of the things that you're reading online, the vast majority of them are anecdotal. The vast majority of them are, oh, I tried this and it worked for me. My aunt tried this and it worked for me. But when you really delve into the evidence-based research on nutrition for survivorship, there isn't a lot out there. The recommendations for cancer survivors are the same recommendations to prevent cancer. Eat fruits and vegetables, eat protein. There's nothing really out there that's cancer survivor specific that's addressing some of the late side effects that cancer survivors are experiencing to prevent specifically cancer recurrence and second cancers. And that's specifically where we are doing our projects, is in that cancer survivorship realm, so that we can guide more specific recommendations. If this research isn't done, people are going to keep guessing. They're going to keep going to websites, reading anecdotes on forums. Oh, this worked for this person, I should try this, maybe I could try this. And they're not going to have that larger clinical trial that actually scientifically can demonstrate whether it's effective or not. People think antioxidants are healthy, they can help me stay strong to fight this cancer. But what can happen is the antioxidants can help the cancer fight the chemo. Right now, there are very, very few supplements that have been tested in the cancer setting for effectiveness, especially during chemotherapy. Oftentimes, when a patient gets a cancer diagnosis, they ask, what can I eat? And they'll look at the recommendations, they're eat fruits and vegetables, get enough protein, and patients want something more specific. They'll go to their clinical care team and they'll say, here's my specific diagnosis, here's my family history, here's my genetics, here's my tumor genetics, here's my blood work, and all we have for patients is eat fruits and vegetables, get enough protein. And people want something more specific. So that's what we're doing in our lab, is we're testing more specific diets, what people are eating, when people are eating, and how much people are eating, to see if we can really leverage nutrition to help treat their cancer and help them feel better during and after treatment. This research is really exciting because it's a relatively simple nutrition program. It is free to implement. Nutrition is very empowering. It's something that you can do. Oftentimes, when you get a cancer diagnosis, there's a lot of things being done to you. People are poking you and prodding you and doing these scans and taking your blood and telling you to show up at a certain time. But nutrition is something that you can control.